A CNA notices that a resident with dementia is repeatedly folding napkins for hours. What should the CNA do? A. Take the napkins away immediately. B. Allow the resident to continue the activity safely. C. Scold the resident to stop. D. Call the nurse right away. Answer: B. Repetitive tasks can be calming and provide purpose for dementia residents. CNAs should support safe, meaningful engagement. When performing perineal care for a female resident, the CNA should clean: A. From back to front. B. From front to back. C. In a circular motion. D. Only if visibly soiled. Answer: B. Cleaning from front to back prevents transferring bacteria from the anal area to the urinary tract, reducing infection risk. A resident becomes short of breath while lying flat during morning care. What should the CNA do first? A. Call the family. B. Raise the head of the bed. C. Begin mouth to mouth. D. Get water. Answer: B. Elevating the head of the bed helps ease breathing before reporting the symptom to the nurse for assessment. Which action helps prevent skin breakdown in bedbound residents? A. Keeping bed linens wrinkled. B. Changing position every 2 hours. C. Applying powder frequently. D. Reducing fluid intake. Answer: B. Regular repositioning reduces pressure on bony areas and maintains skin integrity. When a CNA assists a resident who is deaf, the best communication method is to: A. Speak loudly. B. Turn away when speaking. C. Maintain eye contact and speak clearly. D. Use medical terms only. Answer: C. Clear speech and eye contact allow lip reading and visual communication for hearing-impaired residents. A CNA suspects a coworker is stealing a resident's belongings. What should the CNA do? A. Ignore it. B. Confront the coworker. C. Report it immediately to the nurse or supervisor. D. Tell the resident's family. Answer: C. Theft is a serious violation of ethical and legal standards. It must be reported following facility policy. Which task can a CNA legally perform? A. Administering medications. B. Changing sterile dressings. C. Taking vital signs. D. Giving injections. Answer: C. CNAs may measure and record vital signs but cannot perform tasks that require sterile technique or medication administration. A resident refuses to bathe despite strong body odor. What should the CNA do? A. Force the bath. B. Respect the resident's choice and report refusal. C. Argue with the resident. D. Ask another aide to do it secretly. Answer: B. Residents have the right to refuse care. The CNA should document and report the situation appropriately. When transferring a resident with right-sided weakness from bed to wheelchair, the CNA should place the wheelchair: A. On the right side. B. On the left side. C. Directly behind the bed. D. At the foot of the bed. Answer: B. Positioning the wheelchair on the resident's strong side allows them to assist safely with the transfer. When documenting care, the CNA should: A. Record only unusual events. B. Document after care is completed. C. Write in pencil. D. Share documentation with other residents. Answer: B. Documentation should be timely, factual, and completed after performing care to ensure accuracy and confidentiality. A resident's care plan indicates NPO. The CNA should: A. Offer small sips of water. B. Remove all oral intake, including food and liquids. C. Give thickened fluids. D. Allow chewing gum only. Answer: B. NPO means nothing by mouth. The CNA must not provide any oral intake to prevent aspiration. What is the first thing a CNA should do before providing personal care? A. Check the care plan. B. Begin the procedure immediately. C. Call the family for permission. D. Leave the door open. Answer: A. Reviewing the care plan ensures that care is performed correctly and according to the resident's specific needs. When feeding a resident who has one-sided paralysis, food should be placed: A. On the weak side. B. On the strong side. C. Mixed completely. D. In the center. Answer: B. Placing food on the strong side aids chewing and swallowing, reducing aspiration risk. The CNA notices a resident's catheter bag is attached above bladder level. What should be done? A. Leave it as is. B. Lower the bag below bladder level. C. Raise the bag higher. D. Clamp the tubing. Answer: B. The drainage bag must stay below bladder level to prevent backflow and urinary infection. A resident begins to choke while eating. The CNA should first: A. Perform back blows. B. Call for help and start abdominal thrusts if necessary. C. Offer water. D. Pat their back lightly. Answer: B. Quick action following the Heimlich procedure can dislodge the obstruction and restore breathing. A CNA observes bruises in various stages of healing on a resident's arm. What should the CNA do? A. Confront the resident. B. Report observations to the nurse immediately. C. Wait for more signs. D. Ask other residents. Answer: B. Multiple bruises may indicate possible abuse. The CNA must report suspicions without delay or investigation. Which of the following demonstrates respect for resident privacy? A. Closing curtains during care. B. Leaving door open. C. Talking loudly in hallways. D. Sharing information with others. Answer: A. Maintaining privacy during care upholds resident dignity and confidentiality. When a resident frequently attempts to leave the facility, the CNA should: A. Block the door physically. B. Stay calm and redirect to a safe activity. C. Threaten punishment. D. Lock them in their room. Answer: B. Calm redirection preserves safety and avoids escalating confusion or agitation in wandering residents. The CNA notices a spill on the hallway floor. The correct action is to: A. Walk around it. B. Clean or report it immediately. C. Wait for maintenance. D. Warn only coworkers. Answer: B. Prompt action or reporting prevents slips and falls, ensuring a safe environment. When assisting with oral care for an unconscious resident, the CNA should: A. Use large amounts of water. B. Turn the head to the side. C. Place the resident flat. D. Skip the care. Answer: B. Turning the head prevents aspiration during oral care in unconscious residents. What should a CNA do if a resident begins to cry unexpectedly? A. Ignore them. B. Leave the room. C. Stay, listen, and provide comfort. D. Call the nurse immediately. Answer: C. Emotional support and empathy are essential to resident well-being and trust building. During range of motion exercises, if a resident complains of pain, the CNA should: A. Continue the exercise. B. Stop immediately and report. C. Ignore the complaint. D. Increase the movement. Answer: B. Pain indicates possible injury or overexertion. The CNA must stop and report to the nurse. A CNA accidentally drops a sterile dressing on the floor. The correct action is to: A. Use it quickly. B. Shake off the dust. C. Discard it immediately. D. Cover it with a towel. Answer: C. Once contaminated, sterile items must never be reused to maintain infection control. Which is the safest method to identify a resident before providing care? A. Ask the roommate. B. Check the ID bracelet and confirm with care plan. C. Ask visitors. D. Assume based on room number. Answer: B. Correct identification ensures care is given to the right person and prevents medical errors. When assisting a resident to walk, the CNA should stand A. In front of the resident. B. On the resident's weaker side. C. Behind the resident. D. On the stronger side. Answer, B. Standing on the weak side provides better support and stability during ambulation. Before helping a resident to stand, the CNA should A. Check that the bed or chair brakes are locked. B. Pull quickly. C. Use one hand only. D. Avoid explaining the process. Answer, A. Locking brakes prevents falls and ensures safety during transfers. Which action helps promote independence for residents? A. Doing everything for them. B. Allowing them to perform tasks they can manage safely. C. Rushing their care. D. Ignoring their input. Answer, B. Encouraging residents to do what they can boosts confidence and maintains functional ability. The CNA notices a change in a resident's speech and facial drooping. What should the CNA do? A. Note it at the end of shift. B. Report to the nurse immediately. C. Ask another resident for help. D. Ignore it. Answer, B. Sudden facial droop and slurred speech may indicate a stroke, requiring urgent reporting. What should the CNA do if a resident's family insists on feeding food restricted by the care plan? A. Allow it to avoid conflict. B. Hide the food. C. Report the incident to the nurse. D. Remove the tray quietly. Answer, C. Violating dietary restrictions can harm the resident. CNAs must report family actions that endanger health. A resident with Parkinson's disease needs assistance with eating. The CNA should A. Feed the resident quickly. B. Encourage slow eating and provide adaptive utensils. C. Remove utensils. D. Ignore tremors. Answer, B. Slow pacing and adaptive utensils promote dignity and independence in residents with movement disorders.